Frank Bowers, 73, noticed something unusual that morning in the bathroom. He paused, considered calling his doctor, then shrugged it off. Probably nothing, he thought. I'll mention it at my checkup next month. 3 days later, Frank was in the emergency room. The attending physician looked grave as she reviewed his chart. "Why didn't you come in when you first noticed this?" she asked. Frank's voice was barely audible. "I didn't think it was serious. I thought it was just, getting older." The doctor shook her head. "This particular symptom is never normal aging. We could have prevented this entire crisis if you'd called immediately." Frank would spend the next 6 weeks recovering from something that could have been addressed in a single day, all because he didn't recognize one critical bathroom warning sign that required immediate medical attention. The bathroom isn't just where we handle hygiene. It's where our bodies reveal their most honest truths. Changes that might go unnoticed elsewhere suddenly become visible. For seniors over 65, certain bathroom signs aren't just inconvenient or embarrassing, they're urgent warning signals that something dangerous is happening inside your body. Today, we're covering 5 bathroom warning signs that should prompt an immediate call to your doctor. Not next week. Not at your next appointment. But the same day you notice them. Stay with me until the end, because warning sign number 4 is something many seniors mistake for a minor annoyance, but it could be signaling a life-threatening condition that becomes untreatable if you wait more than 72 hours. Warning sign number 1. Sudden change in urine color. Eleanor Martin, 69, was startled one morning to see that her urine was a deep amber color, almost brown. She increased her water intake, assuming dehydration was the cause. By evening, despite drinking plenty of fluids, the color hadn't improved. In fact, it seemed darker, with a reddish tinge. "It's probably just that new vitamin I started," she reasoned. She'd read that some supplements can change urine color, and this seemed like a logical explanation. Eleanor decided to wait a few days to see if it resolved on its own. 2 days later, Eleanor was in excruciating pain, with a high fever and confusion. Her daughter found her semi-conscious and called an ambulance. The diagnosis: acute pyelonephritis, a kidney infection that had progressed to sepsis because of delayed treatment. What Eleanor didn't know is that sudden changes in urine color, particularly to brown, reddish, or very dark yellow that doesn't respond to hydration, can signal several urgent conditions. Acute kidney injury requiring immediate intervention. Bleeding in the urinary tract that could indicate cancer. Rhabdomyolysis, muscle breakdown that can cause permanent kidney damage. Severe liver dysfunction, particularly when accompanied by pale stools. Certain medication toxicities that can become life-threatening within days. For Eleanor, the initial urinary tract infection could have been treated simply with antibiotics if caught early. But because she waited, the infection ascended to her kidneys and then entered her bloodstream, creating a life-threatening emergency. When doctors evaluate sudden urine color changes in seniors, they're looking for specific patterns. Dark brown urine with tea-colored foam suggests blood. Pink-tinged urine with cloudiness often indicates infection. Cola-colored urine after unusual exertion could signal muscle breakdown affecting the kidneys. Here's when to call immediately versus when it can wait. Call immediately if the color change is sudden and significant. The unusual color persists after increasing fluid intake. There's any pain in your back, side, or when urinating. You have a fever, chills, or confusion alongside the color change. You've recently started a new medication. It can wait 24 to 48 hours if the color change is mild and gradually improves with hydration. You recognize it as related to something you ate, like beets. There are absolutely no other symptoms. You recently had urological tests that your doctor warned might change urine color temporarily. Eleanor recovered after a week in the hospital, but her kidney function remained permanently diminished. "If I'd known this was an emergency signal, I would have called immediately," she later said. "I thought I was being responsible by not bothering my doctor over something minor." In seniors, the body's ability to fight infection decreases significantly. What might have been a simple, quickly resolved issue in your 50s can become life-threatening in your 70s, often within just 24 to 48 hours. Never ignore sudden changes in urine color. It's your body's way of waving a red flag. Warning sign number 2. Unexpected balance problems in the bathroom. Richard Thompson, 78, first noticed it while stepping out of the shower. A momentary dizziness, a slight need to grab the towel bar for support. Nothing dramatic, just a brief unsteadiness he'd never experienced before. It happened again the next morning and the next. The bathroom's just steamy, he told himself. And I'm getting older. He installed a shower grab bar and considered the problem solved. 3 weeks later, Richard fell in the bathroom, striking his head on the sink. By the time paramedics arrived, his speech was slurred, and he couldn't move his left arm. The diagnosis wasn't the fall injury. It was a stroke that had been sending warning signs for weeks, signs that first appeared specifically in the bathroom. New or worsening balance problems that occur primarily in the bathroom are different from general unsteadiness. They're unique warning signs that neurologists and emergency physicians recognize as red flags for several serious conditions. Transient ischemic attacks, mini-strokes, that often precede major strokes. Medication side effects causing dangerous drops in blood pressure. Inner ear disturbances that can lead to devastating falls. Early signs of neurological conditions requiring immediate evaluation. Cardiac rhythm abnormalities that manifest during position changes. The bathroom creates a perfect storm of conditions that can reveal these problems before they're noticeable elsewhere. The combination of temperature changes, position changes, standing from the toilet or bath, closed eyes during face washing or shampooing, and slippery surfaces makes the bathroom uniquely challenging for your balance systems. When these systems are compromised by an underlying medical condition, symptoms often appear in the bathroom first, sometimes weeks before they become apparent in other settings. For Richard, the momentary dizziness while exiting the shower was actually a series of mini-strokes, his brain's urgent warning system signaling an impending larger stroke. Had he reported these symptoms immediately, blood thinners and blood pressure management could have prevented the devastating stroke that left him with permanent disability. Here's what makes bathroom balance problems an emergency. They're new or significantly worse than your normal steadiness. They happen specifically during bathroom activities but not consistently at other times. They're accompanied by any visual changes, confusion, or weakness. They occur alongside heart palpitations or chest discomfort. They begin shortly after starting new medications. Don't be deceived if the symptoms seem to resolve quickly or if they only happen occasionally. The intermittent nature of these warning signs often leads seniors to dismiss them, which is exactly why they're so dangerous. After 3 months of intensive rehabilitation, Richard regained some function but never returned to independent living. I thought installing a grab bar was being proactive, he said during a follow-up appointment. I didn't realize I was ignoring my brain's distress signal. If you experience new unsteadiness in the bathroom, call your doctor the same day. Describe exactly when it happens and any other symptoms you've noticed, even if they seem unrelated. This isn't about preventing a fall, it's about catching what might be causing the unsteadiness before it leads to catastrophic consequences. Warning sign number 3, bathroom cognitive lapses. Martha Williams, 81, had been independent and sharp-minded her entire life. The first sign something was changing came one morning when her daughter found her standing in the bathroom, looking confused. "Mom, are you okay?" her daughter asked. Martha looked startled. I can't remember if I've taken my shower yet. My hair isn't wet, but I'm in my bathrobe." Her daughter reassured her that occasional forgetfulness is normal aging. But over the next 2 weeks, Martha had several similar episodes, forgetting whether she'd brushed her teeth, finding herself unsure why she'd entered the bathroom, or being unable to recall the order of her morning routine. When Martha finally mentioned these incidents to her doctor, he ordered immediate testing. The diagnosis was shocking. Martha had carbon monoxide poisoning from a faulty water heater. The cognitive symptoms appeared first and most prominently in the bathroom because that's where she spent time with the shower running, increasing her exposure. Cognitive lapses or confusion that occur specifically during bathroom activities are distinctive warning signs that neurologists recognize as particularly significant. Unlike general forgetfulness, bathroom-specific cognitive changes often indicate medication interactions causing dangerous neurological effects. Carbon monoxide exposure, especially with gas water heaters. Silent mini-strokes affecting specific brain regions. Electrolyte imbalances that become apparent during morning routines. Infections causing subtle delirium before more obvious symptoms appear. The bathroom routine is cognitively unique. It's a sequential, habitual process most adults have performed the same way for decades. When this deeply ingrained routine becomes confusing, it often indicates a medical emergency rather than typical aging or dementia, which tend to affect broader cognitive functions more evenly. For Martha, the carbon monoxide exposure was gradually causing brain damage that could have become permanent. Because these episodes were recognized as significant and reported, the source was identified and repaired, and Martha made a complete recovery with oxygen therapy and time. Here's when bathroom cognitive lapses warrant an immediate call. You find yourself confused about the order or steps of your bathroom routine. You enter the bathroom and momentarily forget why you're there, when this is new or increasing. You can't remember if you've completed bathroom activities you just performed. You find personal care items in unusual places, toothbrush in the medicine cabinet when you always keep it in a holder. You notice these lapses happen specifically in the bathroom more than in other rooms. What makes these particularly dangerous is that many seniors live alone and may normalize these experiences. They may adjust by leaving themselves notes or creating workarounds rather than recognizing these as serious warning signs. I was embarrassed to mention it, Martha later admitted. I thought my doctor would think I was developing dementia and take away my independence. I never imagined it could be something in my environment that was treatable. If you experience these cognitive lapses in the bathroom, don't wait to see if they progress. Call your doctor immediately and describe exactly what you're experiencing. The pattern of these specific cognitive changes can help medical professionals distinguish between urgent medical conditions and more gradual aging processes. Warning sign number 4. Chest discomfort or shortness of breath during bathroom activities. Howard Jensen, 67, first noticed it while straining slightly during a bowel movement, a mild pressure sensation in his chest that spread to his shoulders. It lasted only a minute and resolved completely. 3 days later, it happened again while he was brushing his teeth, this time with slight shortness of breath. Must be out of shape, Howard thought. Or maybe it's just gas. The symptoms were mild after all, and only happened briefly during bathroom activities. 5 days after the first episode, Howard collapsed in his bathroom. The heart attack was massive. During his recovery, his cardiologist explained that what Howard had experienced were classic warning signs of impending cardiac events, signs that manifest during bathroom activities before they appear elsewhere. This particular warning sign is the one that stroke and cardiac specialists most wish seniors understood: chest discomfort, pressure, or unusual shortness of breath that occurs specifically during bathroom activities requires immediate medical attention, even if mild and brief. Why do these cardiac warning signs often appear first in the bathroom? Several factors create the perfect conditions for revealing heart problems. Bowel movements involve the Valsalva maneuver, straining, which dramatically increases cardiac workload. The act of urination can cause a rapid drop in blood pressure in some seniors. Warm showers cause blood vessels to dilate, challenging a compromised heart. Morning bathroom routines coincide with natural spikes in blood pressure and stress hormones. Cold bathroom environments can cause vasoconstriction that strains the heart. What makes these warning signs particularly dangerous is that they're often attributed to much more benign causes: indigestion, muscle strain, or normal aging. The bathroom setting leads many seniors to make incorrect connections between their symptoms and ordinary bathroom functions. For Howard, those early warning episodes were actually angina, his heart's distress signal indicating severely narrowed coronary arteries. Had he recognized and reported these symptoms immediately, his cardiologist could have intervened before the massive heart attack that damaged 40% of his heart muscle. Here's when to call 911 immediately versus when to call your doctor. Call 911 if you experience any chest pressure, squeezing, or pain during bathroom activities. You have unusual shortness of breath while performing routine bathroom activities. The discomfort radiates to your jaw, shoulders, back, or arms. You feel lightheaded or nauseated along with these symptoms. You have a known heart condition and these are new symptoms. Call your doctor same day. You notice mild but unusual breathlessness only during bathroom activities. You feel generally more fatigued after routine bathroom tasks. You've had to start sitting down for activities you used to perform standing. You need to rest between stages of your bathroom routine. Howard eventually recovered enough to return home, but with significantly limited function and a much poorer prognosis. I keep thinking about those warning signs, he said during cardiac rehabilitation. They seemed so minor, but they were trying to tell me something critical. If you experience any unusual sensations in your chest, unusual breathlessness, or fatigue specifically during bathroom activities, don't delay seeking help. These symptoms in this specific context are recognized by cardiologists as particularly significant warning signs that should never be ignored, even if they seem mild. Warning sign number 5. Sudden changes in bowel habits or appearance. Catherine Simmons, 75, noticed a change in her bowel movements. They had become narrower, and occasionally she saw what looked like dark streaks. There was no pain, so she attributed it to her diet or her age. She made a mental note to mention it at her next checkup, 3 months away. By the time that appointment arrived, Catherine was experiencing abdominal pain and had lost 12 pounds without trying. The diagnosis was devastating: colorectal cancer that had already spread beyond her colon. The treatment would be aggressive and the prognosis uncertain. If I had known this was an emergency sign, Catherine later said, I would have called immediately. I thought changes like this were just part of getting older. Sudden or significant changes in bowel habits, particularly in the appearance, consistency, or effort required, are warning signs that gastroenterologists identify as requiring prompt medical evaluation. In seniors over 65, these changes often indicate serious conditions that become progressively harder to treat with each week of delay. Colorectal cancers that may still be highly treatable if caught early. Intestinal ischemia, restricted blood flow, that can rapidly become life-threatening. Partial bowel obstructions that can suddenly become complete emergencies. Inflammatory conditions that can lead to permanent damage if untreated. Medication side effects that may indicate dangerous toxicity. What makes these symptoms particularly deceptive is their gradual onset and the absence of pain in early stages. Many seniors notice these changes but don't consider them emergencies because they don't cause immediate distress. For Catherine, the narrowing stool was a sign of a growing tumor creating a partial obstruction. The dark streaks were occult blood, small amounts not immediately visible as bright red, but indicating bleeding from the tumor. Had these changes been reported immediately, the cancer likely would have been caught before spreading beyond the colon, significantly improving her prognosis. Here's when to call your doctor immediately about bowel changes. Any persistent narrowing of stool diameter, pencil-thin stools. New onset constipation that doesn't respond to usual remedies. Any visible blood or black, tarry stools. Pale or clay-colored stools. Alternating diarrhea and constipation that's new or worsening. What many seniors don't realize is that the significance of these symptoms increases dramatically after age 65. Changes that might represent minor, self-limiting conditions in younger adults are much more likely to indicate serious pathology in older adults. I thought these changes were just what happens when you get older, Catherine explained during her treatment. No one ever told me which changes are normal aging and which are warning signs that need immediate attention. After aggressive treatment including surgery and chemotherapy, Catherine achieved remission but faced ongoing challenges from the extensive treatment her advanced cancer required. Earlier intervention could have meant a simpler surgery and potentially no chemotherapy at all. If you notice significant changes in your bowel habits or appearance, call your doctor the same day. Be specific about the changes you've observed, when they started, and any other symptoms you're experiencing, even if they seem unrelated. These details can help your doctor determine the appropriate urgency of evaluation. Frank Bowers, the 73-year-old from our opening story, now speaks to senior groups about recognizing bathroom warning signs. His experience with ignoring the sudden, dramatic change in his urine color, which turned out to be a warning sign of acute kidney injury from medication toxicity, nearly cost him his life. "I was embarrassed to call about a bathroom issue," Frank admits. "And I thought I was being responsible by not bothering my doctor with something that seemed minor. Now I know that certain bathroom signs are never minor for someone my age." Frank recovered, but with permanently reduced kidney function that now affects many aspects of his health and medication options. His physician later told him that had he called immediately when he first noticed the warning sign, the damage could have been completely prevented with a simple medication change. The bathroom is where many serious health conditions reveal themselves first, sometimes days or weeks before more obvious symptoms appear elsewhere. For seniors over 65, recognizing these specific warning signs can be the difference between a simple intervention and a life-altering medical crisis. If you experience any of the 5 warning signs we've discussed today, don't wait. Don't rationalize. Don't assume it's normal aging. Call your doctor immediately and be specific about what you've observed. 1. Sudden changes in urine color, especially to dark yellow, brown, or reddish. 2. New balance problems that occur specifically during bathroom activities. 3. Cognitive lapses related to bathroom routines. 4. Chest discomfort or unusual shortness of breath during bathroom activities. 5. Sudden changes in bowel habits or appearance. Your bathroom routine is one of your body's most sensitive early warning systems. Learning to recognize these specific signs isn't about becoming anxious or hypochondriacal. It's about distinguishing between normal aging changes and true medical emergencies that require prompt attention. As Frank now tells the seniors he speaks with, when it happens in the bathroom, don't wait to see what happens next. Make the call. It might feel unnecessary in the moment, but it could save your life. If this information has helped you, please share it with someone you care about. Because recognizing these specific bathroom warning signs could be the most important health knowledge a senior ever acquires.